back to Shriva Talks today. And today we have here our esteemed guest, Dr. Srinidhi Vittal, who is an anesthesia provider who has been in the field for the past 4 years and has worked with several different population groups. Before that, in India, he worked as a writer, a travel journalist, and also a graphic designer. Hi, Uncle. Thank you so much for joining us here today.
Thank you for having me.
Thank you. So the first thing I want to ask is, how is your day today?
Today is day off, so it's a good day.
It's a good day. And it's also July 4th.
Yes,
so,
it's also July 4th.
Yeah. Mm-hmm. So thank you so much for joining here, Uncle. I'm really happy and blessed that you were able to make it here today.
I'm glad to be here. Thanks for having me.
Mm-hmm. It's also curious to note that we have the same first name. So I was just wondering, can I ask how your name? Well, what made your parents choose your name?
Srinidhi is actually a name of Vishnu. Mm-hmm. So it's part of the Vishnu Sahasranama. In my home, everybody's name starts with a Shri.
Oh, okay.
Like my brother is Srinivas, my sister is Srileka, and I'm the youngest Srinidhi.
Okay.
And Raghavendra is my grandfather's name. Mm-hmm. My father wanted to name me after his father. Mm-hmm. So he wanted to Raghavendra, but my mother was insistent that I should be Srinidhi. Oh, okay. So that's why I have two names. My brother and sister don't have two names.
It's still start by asking, can you explain for the viewers what exactly your job as an anesthesia provider entails?
Okay, as an anesthesia provider, my role is to make sure that the patients are comfortable during surgery. And that is from a patient perspective. I want to make sure that they don't feel pain, they don't feel any discomfort, and they don't remember the surgery. Oh. That's my role. From a surgeon perspective, I want to make sure the patient doesn't move. Because when they're doing surgery deep inside the human body, if the patient moves, the surgery could go wrong. Okay. So they have to be immobile. So anesthesia basically involves three things. Amnesia, which is forgetting, analgesia, which is painlessness, and then akinesia, which means no movement during the duration of anesthesia. So I take part in surgeries with the surgeon. So basically I interact with the patient first, I get them off to sleep, protect their airway, ensure that they're still breathing and alive. Then the surgeon takes care of surgery. Once the surgery is finished, I wake up the patient and make sure that they're safe still.
Okay. So is it you have to give them a pill, a shot? Is it?
Anesthesia in the operating room, it's all IV or gas.
Okay.
So they have an intravenous line before they come to the operating room.
Well, what's that?
Intravenous line. They put a little catheter or a tube inside their veins. Okay. That's how I give them medicine, like a shot. Okay. But not a shot. When you think of a shot, you think of like an injection. Right. With the needle. But in anesthesia, we don't use needles in the OR. We start the intravenous line before in the preoperative area, and then they come to the OR with the intravenous line running with some saline or other solutions. We give them medicine. I administer a sleeping medication to them. So the medicine gets them off to sleep. Once they're asleep, depending on the kind of surgery, depending on the kind of anesthesia required, I either put a tube down their throat that goes into their lungs, and that helps them breathe through the procedure. And once the patient has a tube inside, they get connected to a machine called the ventilator or the anesthesia machine. The anesthesia machine delivers oxygen and anesthesia gas. So the anesthesia gas is what keeps the patient asleep during the surgery. Okay. And once surgery is finished, we turn off anesthesia gas and just let the patient breathe oxygen. Probably in about 10 to 15 minutes, they breathe oxygen, the anesthesia gases out of their system, and they wake up.
Oh. So, do you work with all sorts of surgeries?
Yes.
So, can you please give some examples of some
surgeries? Can be as basic as laparoscopic cholecystectomy or gallbladder surgery. A simple surgery like gallbladder removal, or in terms of in kids, we do tonsillectomy, we remove the tonsils. Oh, okay. So that's a very simple surgery, as complex as brain surgery. Oh. I've been involved in both of them too. That way.
So I know I remember that you've been involved for only about 4 years now. So like before that you were a writer. What made you transition?
Well, 4 years I've been an anesthesia provider, but before that I was a critical care nurse.
Oh, okay.
So I've been involved in healthcare since 2012. So that's about 12, 13 years now. So before that, I got into healthcare basically because I came to America.
Okay.
When I was in India, I used to be a journalist, like you introduced me before. After I came to America, I was trying to figure out what to do. One of my wife's best friends is a nurse in Dallas.
Okay.
And she introduced me to this career in healthcare, saying you become a nurse and then you gain experience in critical care. Then you don't have to go to medical school, you can go to anesthesia school straight away when you become a doctor. Because if you go to MD route and go become a doctor, it takes about 17 years.
17 years?
Yes.
Oh, wow.
Minimum 12 years, maximum up to 17 years. But the way I went through, I can become a doctor in 7 years.
Oh.
So basically 4 years of undergrad degree in nursing, 2 years of work experience as a critical care nurse, and then 3 years of anesthesia school.
So it's like because you have live practice, it took less time than the standard procedure.
Yes. So anesthesia is basically involves a lot of intense care, as in the patient's life is in my hands. I can decide whether the patient is living or died at that point. My mistake can kill the patient right away.
Oh.
So it's if you have experience in an intensive care unit or in a critical care unit, you can go to anesthesia school straight away. Okay. So it's like in IT they always call it as equivalent, like either master's degree or equivalent experience.
Okay.
So similarly in anesthesia school, that's how I got into anesthesia.
Okay. So can I ask about any like certain situations that were particularly scary in either critical care or in anesthesia?
Well, let me tell you something that happened in Florida when I was a critical care nurse. So I had this patient who had a internal bleeding, and they couldn't find where the bleeding was going on.
Oh.
So they had done all kinds of imaging tests and endoscopy. They still couldn't find the bleeding. So this patient was bleeding like continuously.
Oh.
We were giving blood and she was bleeding it out. So ultimately I said, let's go to interventional radiology, where we can put an X-ray probe inside her body and find the bleeding and close it. So we took the patient to IR. By this time, if we hadn't taken her at that time, she would have died.
Oh.
So we took the patient to IR at that time, and then we immediately found the bleed. It was in the lower stomach, which no scope can go to lower stomach to find it, because she already had a gastric bypass in the past. So the endoscopy probe wouldn't reach the lower stomach, and that's how we couldn't find the bleed. So in the interventional radiology, we were able to find the bleed, clip it, and then bring her back to the ICU, and then gave her more blood, and then she's living today.
Okay.
That was a very scary situation, because I did not know what I was trying to do, but I just wanted to save the patient. And very little cooperation from other people, but I had to. It was a weekend, it was a Sunday actually, I remember that very clearly. And the interventional radiology department is closed on Sundays. We had to call the on-call people to come in to the hospital, and they take about 30 minutes to get there. So we had to keep the patient alive for 30 minutes till they get here, and then get her back. So that was a very scary time for me.
Oh. Is it like the first time you had to experience like a life-threatening?
No, not the first time, but definitely very scary.
Because it was like unusual in a sense?
Unusual bleeding.
Okay.
Like we had given her already 5 or 6 units of blood and she was still...
So I'll just again ask about like how your day is going, like how the day progresses. So you said it starts at 6:30 in the morning and then you have to continue on.
Yeah, so my typical day starts at 6:30, between 6:30 and 7 in the morning. I have to be in the hospital, see the patient, make sure the patient's ready for surgery. So sometimes, let me give you a live example. So there was this patient for a knee replacement surgery. Diabetic patient, history of diabetes, arthritis and all those things. So we checked their blood sugar before we go back to surgery. So when we checked her blood sugar was like 300 something.
Is that high?
That's very high.
Okay.
Blood sugar should be less than 100 for a normal patient.
Oh.
For a diabetic patient, we are okay for it to be up to 180.
Okay.
Anything above 200, we do not do surgery. Because if the blood sugar is more than 200, the risk of infection is very high.
Okay.
So for this patient, we had to do a blood sugar before we do anything else. So we had started an IV, we got a blood sugar test, it was 300 something, and we had to cancel the case. The patient was not very happy because she had waited for like a few months to get a new knee, because she was in a lot of pain and discomfort because of the bad arthritic knee.
Right.
But she couldn't get surgery that day because of her high blood sugar. So these things happen. So we have to make sure the patient's ready for surgery. We have to make sure that the blood pressure is normal, blood sugar is normal, that they have taken the meds they're supposed to take in the morning before coming to the hospital, and they have discontinued the medicines they are supposed to not take that day.
Okay.
Because some patients are on prescription medicine at home, blood pressure medicine and other things.
Right.
We tell them to stop certain medications and continue taking certain medications, depending on their prescription. Once that is done, we take them back to surgery, and usually on a typical day, if it's a short day, like 8-hour day, there are anywhere between 3 to 4 surgeries in a day.
Okay.
But sometimes I've done 24-hour shifts also. Sometimes I do 24-hour shifts where I stay in the hospital. So what happens is we are working till there is work. And if we have a downtime, we have a little call room where we can lie down and rest. But again, if we get called, we have to go and do whatever needs to be done. Like we get called to the emergency room for if there is any accident case that comes into the hospital, they need airway management, we go and manage their airway. Or if they come in and they need some other support, we go and support them. Same with the ICU, same with the operating room. And same with labor and delivery also. Because when patients are in labor, when women are in labor, there is a lot of pain. We give them an epidural, and the epidural helps them labor comfortably.
Okay.
That way.
Okay. So you mentioned that sometimes cases get cancelled as well. Would that also be considered downtime, or would the other procedures be moved ahead?
Oh yeah. If one case gets cancelled, the other procedures are moved ahead.
Okay. Because
there are patients waiting. So if somebody is scheduled at 10 o'clock, we'll call them and tell them, can you come early? So they'll be happy to come in. Okay. In a typical hospital time frame, if the surgery is scheduled at 7:30, we tell the patient to come there at 5:30, 2 hours before.
Okay.
1.5 to 2 hours before. Because we know if we tell them 2 hours before, they may come only 1.5 hours before. We don't know. So we tell them to come 2 hours before, and they come in, then we prepare them for surgery, because preparation time takes that much.
Okay. So like preparing is like what you said before, you have to make sure that they're ready, they're taking the right medications and like other procedures like that?
No, the procedures basically, if they need an EKG, we need to do an EKG. Like a heart, EKG is electrocardiogram.
Okay.
That is to make sure that the heart is working properly.
Okay.
So sometimes we need to do an EKG in the morning before we start surgery. So that takes about 15-20 minutes. We need to start an intravenous line for them, give them some preoperative medicines. So all those things go through that. So all those things have certain time frame to be taken. Time takes time. So that's why we call the patient early, 1 hour, 1.5 hours early to the hospital, so we can do all this time and be ready for surgery.
It seems like a very exhausting lifestyle.
Not really. We have support.
Okay.
There are a lot of people doing different roles, so everybody has a role to play, and they all do their job properly.
I think you were mentioning that you work at 3 different locations. So are there so how many people who do similar jobs to you at each location? Is it
a lot of people.
Okay.
So at Kaiser San Jose, which is my primary job, we are a department of about 70 anesthesia providers.
70?
70, yeah.
Oh, wow.
On a typical day, there are at least 25 to 30 people working. Because we have 14 operating rooms. We have 3 outside operating room anesthesia provision areas where we do endoscopies, colonoscopies and things like that. These are like short procedures, but they still anesthesia support.
Okay.
Then we have 2 people in labor and delivery who help laboring moms to either with an epidural or do C-sections. So we need to support some of them. So typically we have at least about 25 to 30 people working.
So does it like rotate?
Yeah, it rotates.
Okay.
Typically, I don't know what I'm going to do till I get to the hospital.
Oh, okay.
Like tomorrow, I'm working. I mean, tomorrow I know what I'm doing. But what I'm saying is like, in Kaiser, typically you don't know. When you go there, you know your assignment, and you go to that room and get set up and get ready.
Okay, so you have to be very sharp, like on the clock.
That's why we go through so much school.
Okay. So are there like specific days which you work, Uncle, or like do you just get called in?
We get called in. No. We have scheduled days. Our schedule is made 6 months in advance.
Okay.
So I actually know when I'm working for the next 6 months. So I know what days I work. So I go those days to show up at work, and the days I'm off, I know.
So it's basically, it's not like, oh, you go here on Monday to Friday. It's not like that.
Nothing like that.
Okay, so can you choose your schedule?
I can.
Okay.
We call it what we call a self-scheduling. So we schedule the days that we're going to work. We put it up in the calendar. There is a common calendar for the whole department, online, of course. So we all log into the same system and put in our requests to work those days.
Oh, so it's kind of like you're booking shifts for...
Kind of like that. Then there is, of course, our boss who there is a scheduler. I wouldn't call him the boss, but he's a scheduler. So he will look through the schedule, and he'll look through the operating room schedule also. And then he'll fill up the needs that we need. So if like say, we need only 10 people on a particular day, and 15 people have wanted to work those days. Of course, you can't have 15 people in the hospital.
Right.
So the other 5 people will be moved to other days.
Okay.
And sometimes, and that depends on priority. So if I've requested this shift early, I'll probably get it. If somebody has requested much later than me, they probably won't get it. They'll be moved to another day. Okay. And same thing can happen to me also. If I'm the last person to request a particular day, I may not get it.
So like does it, so I know that some procedures are scheduled way ahead in advance. Is it dependent on that? Like how many surgeries they have that day? Or?
So typically we are operating 14 ORs every day.
Okay.
There are 14 or more surgeons willing to work every day. And we have a lot of patients. So that will continue. It doesn't require how many scheduled procedures. We want to populate every OR with one anesthesia provider. So we make sure that every place that needs anesthesia, we want to have a provider there.
Okay, like just in case like something happens. Or...
Exactly.
Okay, so there's always someone on standby.
Yes.
Okay. So basically, it's not super hectic, but it can get hectic.
Yes, it's steady always. We call it steady and crazy busy.
Okay.
It can get crazy busy sometimes.
I suppose this is a very direct contrast from your previous job working as a writer or journalist.
It's different, but it's similar and different.
Okay.
Like as a journalist, I used to look for news stories because I had to inform the people in the newspaper who reads the newspaper. So we would find things happening all over the state or country, and sometimes people would invite me to attend a particular event and report on it.
Oh, like a news conference.
Like a news conference. So I used to attend that. And sometimes people would want me to go to a particular location because if the government has prepared a new holiday destination, a tourist destination, how will they publicize it? They'll invite journalists to go there, experience the destination, and we write about it.
Okay.
So that way, those things have happened too.
So I've always been very curious to know, like, how does a journalist get the information so fast?
So we develop as a journalist when you start working, the day one you won't know anybody. So as you work, you develop contacts in various departments, various industries, various places. So when something happens, they call you.
Oh, okay. So
That's
like,
it.
oh, you need to tell this version of the, like this what happened.
No, not this version. That they give us information that this happened, and we decide do more investigation and decide what's actually happened. We present the facts to people.
Okay. So is it like? Oh, I'm sorry. I got blanked out for a second. So it's like, oh, you go to this. It's like detective work, basically.
Pretty much, yeah, similar.
Okay, so like, oh, you have to fact check everything. Go to several. Is that also more time taking in a way than staying at one like hospital type of thing?
It could be more time taking sometimes.
So like, is it odd working hours or?
Yeah.
Okay.
There is as a journalist, there was no working hours for me.
Oh.
I used to sometimes work in the office till 2 o'clock in the morning. I'd come home at 2 in the morning after sending the paper to the press.
So, like, both of them are kind of high stress and like
yeah, it depends. Depending kind of stress, different kinds of stress, but yeah, both are high stress.
Okay. Yeah. So, like, you have to be involved in the information gathering aspect and also communicating and also writing. So
yes.
It's a lot of work.
It's a lot of work, yes.
Okay. And then you mentioned that, like, is travel writing also similar to that? Or?
Travel writing is more relaxed. It's not intense. It's more you go to a holiday destination, you find out more about it, you write about it, present the facts basically.
So did you go out of country or was it mostly in India?
I traveled mostly in India, but I had the opportunity to go to Malaysia once and to Dubai once. So yeah, I did a couple of travels outside India.
Were there any notable travels, Uncle?
A lot of them. I mean, I've traveled everywhere in India. I've visited all the states in India. I've visited Bhutan, which was very beautiful, and a couple of places in Nepal. So all of them are, each experience was different for me.
Like, do you still enjoy traveling if you had time?
I do. If I had time, I would still want to travel. More like, I'm more of an adventure travel person. I'm not a big fan of going to museums.
Oh, okay.
I would rather go do whitewater rafting.
Oh, water rafting.
Yeah, whitewater rafting or go climb a mountain, like mountaineering in the Himalayas, things like that. So those are the kind of things that attract me more.
Do you have like, because I remember that, like, I've seen like a show where this person, he travels and rides a lot, but he also takes a lot of pictures. Did you all take pictures of
yes,
the
I
time
did.
and stuff? Was those part of your publications as well?
Yeah.
Okay.
Yeah.
Did you ever do like wildlife?
Wildlife photography? No, I did not do it. I've seen wildlife in the wild, but I'm not that good a photographer to take those things.
I've seen like a wildlife, because on the internet I see, so like there's a lot of people who do the nature and stuff.
Yes.
So I was just wondering.
Yeah, that's a different field. It takes a lot of patience and a lot of high-end equipment. I'm not into that.
Okay. What was the focus of your like the photos?
Just to be whatever sceneries, nature, natural landscapes, things like that.
Okay. And then you also mentioned that you did graphic design at the same time.
Graphic design was mostly for advertising. So whenever the publication I worked for, we had a short, a small team. So I kind of doubled up as a graphic designer. I started as a graphic designer, then I moved to journalism. That's how it was.
Was this also like kind of difficult? Because I've tried graphic design a little bit, but I'm not like super advanced at it. Would you say it's like, because it's also something I'm sort of interested?
It is not very difficult. It's just that you need to develop and learn design. It takes time. Everything takes hard work.
Right.
And you have to keep working at it, then you'll get better at it.
Okay. And what was the process with like the bachelor's degree? How did you get?
Oh, my first degree, I've not done anything related to my education in India.
Oh, okay.
Because my first undergrad was in microbiology.
It's microbiology, okay.
Yep. And then I did a master's in journalism. So that's how I got into journalism.
What was the reason for the contrast? Because
I did my microbiology, and I was thinking initially I thought I would go into microbiology, but then I realized towards the finishing of my degree I realized that I'm not interested in that.
Okay.
So I just said I have to do something else.
Is it still like useful now as an anesthesiologist?
It kind of gave me a little foundation for when I changed careers back into healthcare. The microbiology degree kind of helped me with some foundational aspects.
But is it relevant to what you're...
No, not my current job, no.
Okay. But would you say that you're glad that you learned it, or if you went back in time, would you do it again? Or would you do something else?
I don't know, maybe I would do it again.
Just for the fun of it?
I mean, there is certain foundational aspects of microbiology that I did. It's not relevant to my today's job, but the knowledge is relevant. So that's okay.
Okay. Yeah. So actually, I also want to be a writer in the future, like maybe as a part-time job, or like maybe as my main role too. So do you have any advice for any like prospective writers?
Well, my advice is to read a lot and write both, because writing does not come as an island. It's not individual. It's skill. Your writing gets improved by the more you read, the better of a writer you become. Because the more you read, the more language you get exposed to, and the more better you can write. That's how it is.
And are there any particular like writing techniques or anything like that?
Not really. Everything is just. I mean, as you read more, you understand writing better. So I would say, if you're interested in becoming a fiction writer, read more fiction. If you're interested in just becoming a writer, then read non-fiction, fiction, everything. A broad range of topics.
Okay.
And the best way for you at your age, if you want to start honing your writing skills, the best way to start is start a blog.
Oh yeah, I think my mom mentioned that she was trying to get me into it a while ago.
Yeah, just start a blog and start writing, and see how much followers you can get, what kind of feedback you get online, all those things.
I remember, that you mentioned that you wrote several different topics. Do you have any like recommendations in those topics, or like for books to read instead of just write?
No, like I said, I mean, you can read any subject.
And it wouldn't really matter?
It wouldn't matter.
Okay.
The reading improves your knowledge as well as your language. You will come across new words, new sentences, new phrases, and those things will help you hone your own writing skill.
And so, is it ever relevant now as an anesthesia practitioner? Or
as in writing?
Yeah.
Yeah, I do write now, but mostly science subjects. So when I have to write my reports or publish something about anesthesia, my writing skills definitely matter. They help me.
Is that something that helped you get into like the field?
Not really.
No. It's like completely unrelated.
Not unrelated, so yeah.
Okay.
It has helped me when I'm in the field. Yeah, it definitely helped me, but not getting into it.
It's so interesting because like most people I talk about, or talk to, they say they always have a set path and they follow that path. But I think it's the first time I'm hearing about like someone who did something completely drastically different.
Yeah, it is. My life has taken me in different paths, so I'm just open to new experiences. If you have an open mind, these things are not challenging.
I think that's really, really cool because I also have like a lot of different interests.
Yep.
So it's really nice to meet someone that like has so many different things.
Yep.
Also, just to mention, this is something that Uncle has designed and given to me. It's very
You can
cool.
zoom it, you don't have to walk that
fast. Yeah. I actually wear it very frequently, like when I'm going to like events or something
Nice.
like that.
It looks very nice on you.
Thank you, Uncle. Okay, picture this.
Thank you for that drawing. It looks very nice.
Thank you, Uncle.